Hello, welcome to this afternoon's webinar. Thank you for joining us today. My name's Clare, Allcock. I'm from Kaleidoscope Health and Care, and I will be facilitating today's webinar on the lessons from the Healthy Newtown programme. So thank you for joining us. We will be recording this webinar today, so we will be circulating the link afterwards to attendees, but also we'll be hosting it on the NHS England website, so you will be able to view it again or share it with colleagues. So today's session, as I said, will focus on the lessons from the Healthy Newtown programme. I think we're going to move on to our slides now. So you will have an opportunity to learn more about the programme itself, hear more about putting health into place from the people that have developed it, and also have an opportunity to hear some practical insights and learning from some of the 10 demonstrator sites on how they've sought to create places that promote health and well-being. We'll also have a chance after people have spoken to discuss some of the questions that you have posed to the panel. So there are two ways that you're able to join the webinar today. We're going to have some speakers, as I said, and then it would be great to hear from you. If you would like to contribute, you can use the Ask Question feature. Just click on the question button and type in your question and we will pick it up. Or you can email us if you would prefer. You can email us at hello@kscopehealth.org.uk. So we welcome all suggestions, comments, advice or questions. So I just would briefly like to introduce my speakers. I'm delighted to be joined by 4 people today. We've got in the studio Emily Hough, Director of the Strategy Group at NHS England and Improvement, and Julia Thrift, who's Projects and Operations Director at the Town and Country Planning Association. And then we have joining us remotely, we have Kevin McGeough, Director of Ebbsfleet Garden City Healthy Newtown Programme, and Kate Hillerby, who is the Healthy Newtown Programme Lead in Whitehill and Bordon. So that is fantastic. So just before we move on, just a reminder, if you want to use the Ask Question feature or email us, please do so throughout the afternoon. So just hand over to Emily. Thank you.
Thanks, Claire. So I'm here to tell you a little bit about why we set up the Healthy Newtowns programme. So if I can have the next slide, please. Okay, I'll just crack on.
Crack on, yeah.
So the Healthy Newtowns programme was set up following the 5-year forward view in 2014. And as we set out again in the NHS long-term plan this year, we think it's really important that the NHS recognises the wider role we have to play in influencing the shape of local communities and the future of the built environment. We know that only about 20% of health outcomes are determined by clinical care, so we need to look at other factors that are influencing our health and well-being, and housing and the environments that we live in are, of course, central to that. So next slide, please. When we set up the programme in 2015, we had the objective of thinking about how we can plan and design a healthy built environment, how we can enable strong, connected communities and create new ways of providing integrated health and care services. So we embarked on working in partnership with 10 sites across the country to test out what works in incorporating a focus on prevention, wellbeing and active communities into new housing developments. The 10 sites are listed on this slide, and if you want more information about each of them, you can read about them in the Putting Health into Place publication. Next slide, please. So working with the sites for the last 3 years, they've all been quite different sizes, different locations across the country, different demographics, and but one thing that they've all done is form local partnerships, have the NHS working together in partnership with local government, local developers and the future local communities. Centrally, we've provided some capacity and funding to enable the testing of new ways of working, and it's been great to work in partnership with such a broad range of partners through this programme and in evaluating findings from the programme to put into Putting Health into Place, which Julia will touch on in more detail shortly. We also have worked in partnership with developers and housing associations so we can really understand more about how different partners work. And we've had quite a broad impact across the programme so far. On the next slide, you'll see that across the 10 demonstrator sites, we've been working in supporting the development of over 58,000 homes across the country. Since we published Putting Health into Place, we've been working to support 6 further sites learn how to apply the principles and thinking about how we can influence future national policy. And I'm really pleased that so many people have signed up to join today, because what we're hoping nationally is that you can take the insights from this programme, from Putting Health into Place, and apply those locally in areas where you are looking at putting new local housing developments into place, or perhaps looking to regenerate an existing development. We hope that these principles will enable health, local government and other local stakeholders to come together and do that effectively. And we hope that you get a lot from the lessons that we've had so far.
Fantastic. Thanks, Emily. That's great. So we're just going to hand over to Julia to talk a bit more in detail about putting health into place. Just as a quick reminder, as I said, throughout the presentations, please do ask any questions or share any thoughts that you may have. As I said, you can use the Ask Question box on the GoToWebinar and just slot that in there and we will come to you, or email us hello@kscopehealth.org.uk. So I'll just pass over to Julia.
Thank you. Could I have my first slide, please? Great. So as Emily has explained, the Healthy New Towns project lasted for 3 years and involved 10 different sites across England. And through that process, an enormous amount was learnt about how to create new places that make it easier to live a healthy life. And if you do get ill, to have 21st century healthcare provision. So an enormous amount was learnt, and we then had the challenge of collecting all the information together in a way that would be useful for other people, and working with the King's Fund, the Young Foundation, with support from Public Health England and NHS England. Collectively, the TCPA, with all of those partners, worked to create the Putting Health into Place publications. The 4 publications work as a set. They can all be downloaded. They're all free. They can be downloaded from NHS England's website at that address. The first publication, the blue one, sets out everything you need to know about the Healthy New Towns project, where the 10 sites were and what has been learnt. So provides more information to the introduction that Emily has just run through. The next 3 documents provide a how-to guide for creating a healthier new place. Next slide, please. The aim of these documents is to be very, very practical and informative. There are lots of images, there are lots of graphs. The information is broken up into chunks to make it as easy as possible for people to use. And so in essence, it explains how the health service works to planners. It explains how planning works to health service people. It also provides a lot of information about how to really work in collaboration with communities to provide places and healthcare that will really help those communities and help reduce health inequalities. So it's a very practical guide, and it's really about people. It's about creating places where people can thrive. We hope that you'll find the information useful, and to make it as easy to use as possible, it's been broken down into 10 principles. Next slide, please. So Putting Health into Place is primarily aimed at people who are going to be working on brand new places, new neighbourhoods, new garden cities, new developments. Although a lot of what's captured in these documents is also going to be useful for those of you who are working to improve existing places. But the first 3 principles, which are captured in the first document, Plan, Assess and Involve, are very much about the start of the process, about getting the right people involved. And one of the lessons from the Healthy New Towns project was that quite often to begin with, there weren't enough of the right people involved. So if you're really trying to create a healthier place, you really need to involve a very, very wide range of people, not just developers and planners and the healthcare sector, but also local community groups, perhaps local educators, a huge range of different people. And part of the problem with long-term development is it does take such a long time. If you're creating a very large new development, it could take 20 or 30 years. So it's very important to have a collective vision of what you're trying to achieve and some governance structures to help you work over that very, very long time scale to make sure that everybody can contribute and that you don't lose sight of what you're trying to achieve. And all of this is set out in the first 3 principles. The second principle is looking at making sure that you really understand the health needs of your local community. Because England is a very populated country. Wherever you're going to build a new place, there will already be a population. And as people move into the new development, they will come with their own health needs. And the third part of this first document is about making sure that you work with a very wide range of community organisations and people to help ensure that the place you create works for everybody. Next slide, please. The second document, Design, Deliver and Manage, sets out principles for creating a place where it's easy and affordable to make healthy choices. So that's making sure that you create a place that's compact, that isn't just a sort of dormitory suburb, but has the things that people need close by so that they can walk there or cycle there, so that people can live active lives in their day-to-day routines. And that includes making sure that healthier eating is part of the new development. And I think for planners, thinking about what's known as the food environment is a new thing to have to think about. How to create homes and buildings that really do meet the standards that are necessary to support good health. And really importantly, to make sure that places provide healthy leisure and play opportunities for all ages. Next slide, please. And the final document is all about creating places that provide 21st century healthcare. And so a lot of that is about creating the services that are necessary to help people stay healthy. So that might include a GP, but very often it's also about what's called social prescribing. So, for instance, if you have an elderly population, as well as having medical and healthcare provision through a GP, it might be really important to have exercise classes that will help that population remain fit and healthy. It might be necessary to have cookery classes if people are struggling to provide healthy food. So in order to support those services, some sort of health hub might be appropriate, and that could include healthcare services, but also social prescribing. It might include a library. It might include spaces that could be used in different ways as time goes by to provide a range of different services that will help people live healthier lives. Creating those centres isn't always easy. It means aligning different budgets and getting a wide range of people to work together. But this guide provides some very practical steps that you can take to make that happen in your new place. Next slide, please. And throughout putting health into place, a really strong theme has been how can we create new places that will help reduce health inequalities, because if we just create places where healthy people stay healthy, that's great, but we really need to create places where the least healthy can find it easy and affordable to live healthy lives. And so that's a thread that runs through the whole of putting health into place, is thinking about what do we need to do to create a place that supports the needs of the least healthy or the least active. And that involves really working closely with local communities to understand what their needs are and how they can be supported. Thank you.
Thanks, Julia. That was a really helpful overview of the different principles in putting health into place. It's a really great document with lots of helpful and really practical examples and advice. So before we move on to hearing from the demonstrator sites, again, just a quick reminder, do post any questions you may have in the Ask Question box or by emailing us. at hello@kscopehealth.org.uk. I'm now going to pass over to Kevin to talk about experience from Ebbsfleet.
Good afternoon, everyone, and thanks for the opportunity to share some of our lessons from the Ebbsfleet Healthy New Town. And for Julia's really give us a really good introduction to some of the principles that we've learned through the Healthy New Towns. And I really just wanted to pick up this afternoon really on a few of the key ones within those 10 principles that Julia mentioned, and give you some examples, really, some real life examples of things we've done here and how we've actually learned through the programme. Just on my first slide, please. So just to put it in context, Ebbsfleet Garden City is the first of a new generation of garden communities. We're the first new town designated for 50 years and the largest of the Healthy New Town programmes. We've a proposal for 15,000 homes and 30,000 jobs to be delivered over the next 15 years. What's very interesting about Ebbsfleet is that we're a brownfield site, not a greenfield site in terms of a new town environment. And in that instance, that means we've got existing communities working with. So we're between the towns of Dartford and Gravesend, and within our red line boundary, we sort of embrace the existing communities of Swanscombe and Northstowe. And that gives us a real opportunity and a challenge, really, in terms of thinking about a garden city and a healthy new town and what that can mean. In terms of our actual partnership, we were a partnership between the local clinical commissioning group at Dartford, Gravesham and Swanley, and themselves, the Development Corporation, with strong support from Kent County Council. In terms of just looking at what we learned, if we just move on to the next slide, please. Like all of the Healthy New Town pilots at Ebbsfleet, we pretty much had 3 strands of work. One that looked around the new model of local care, one that looked about the design of the built environment, and another one that considered how we work with communities to shape and change their behaviours. And actually, the first example I'm picking up today is both of those things, both the new model of care and working with existing communities and the new population. In developing a vision for a new health and wellbeing hub, or the new provision of local care in the garden city should be, we used a sort of a design charrette, a kind of architectural tool, to bring local stakeholders together so that they could genuinely tell us what it was going to be like and what they'd like to see in the new health provision locally. You can see from this slide that the real focus from people, this is what local people told us, was on well-being and prevention. So our model for the new model of care, the new health and well-being hub at Ebbsfleet, is very much one that's about well-being. Only 70% of the space will be well-being and 30% will be medicalisation and GP services. So giving us a very different vision of what care should be and what people wanted. And it was very clear from local people to take better control of their own health outcomes. If we move on to the next slide, please. So our second programme of work really was really designing this garden city, an exciting opportunity for us here in Ebbsfleet, but one that hasn't been undertaken for many, many years. So through the Healthy New Town programme, we launched what we call our Landscape Design Challenge. Our existing sites are, as I said, brownfield, they're former quarries. Existing communities tend to live at the top of the quarries, and many of our development sites are at the bottom. So we run an international design competition through the Healthy New Town programme, which asked people to explore how we could design this new place in such a way that it would encourage people to have healthier behaviours and healthier lifestyles in the design of that place. Our winning image in the top left-hand side here is from our Blue Lake development. And basically just give us the vision, setting the ambition for what our parks of the future could be like. And we're very excited about this. We're now trying to implement this project. And it also gives a sense of how interested people nationally and internationally are in healthy new towns. We have over 500 million people viewing across the world this winning entry from the Landscape Design Competition as part of the Healthy New Town programme. Next slide, please. But in terms of everything we do, whether it's the design of the model of care or thinking about how we design the environment, what became very clear to all the Healthy New Town programmes, including ourselves, or the demonstrator sites, was that we have to work and understand local community and what local people actually want. And we really have to design a place that responds to their needs and ambitions and actually helps people take control of their health and helps people live in this place. One example which I'm highlighting here today is our Better Points app. Better Points is an existing platform that encourages healthy behaviour and actually rewards people for being active. In this instance, we work with Better Points to develop a specific programme for Ebbsfleet called Get Active in Ebbsfleet, which which basically paid people through vouchers, which they could exchange for anything from Waitrose to a local gym, for being active, for cycling, for walking, for running. What's been amazing in Ebbsfleet so far is that we've got almost 1,200 users of this app, and 60% of the users actually are continued users and continue to engage with the app, having an amazing effect on the CO2 reduction and the health of our local people. And lower in the southeast, we still have considerable quality of life issues, including adult diabetes and childhood obesity. So things like the Better Points app has really helped us work with local people to help them help themselves to improve their health outcomes. Move on to the next slide, please. As I said, one of the key issues locally has been things like diabetes and obesity. We also found in our existing communities that there were 90% below in one instance in terms of access to green space. So they're not surprising that people weren't having a very active life. And we also had a 40% below national average reporting of eating healthily. So we tried to come up with a program that was both interesting and engaging for our local community that involves healthy eating, which Julia's just mentioned as well. Our concept, building on the ideas from Incredible Edible toward Bordon, was for a concept called Edible Ebbsfleet. Edible Ebbsfleet is a program where we have started to work with existing community groups and existing interest groups to plant fresh fruit and vegetables on bits of leftover space or bits of green space in churchyards, community hall spaces. And every one of our new schools and existing schools will have an allotment. And as well as growing food, we'll also have a whole program of sharing how to grow and also cooking. So we have parents have classes with kids in the local schools, teaching them how to cook better and cook more healthily. And through this program of Edible Ebbsfleet, we've managed to almost create a revolution in terms of food, in terms of growing food, sharing food. We have numerous events now where people actually have cooked the food and share with local people in the community. Our developers have very much embraced this whole concept, so it's not just led by the Healthy Newtown or us as a development corporation. Developers are now putting allotments and community gardens in all of their sites and putting planters across the whole local area. And it's not just about residents, it's also about some of the workers here. For example, Ebbsfleet International Station, the workers there have an Edible Ebbsfleet community garden also, and they go there and tend to that in their spare time and after work. So again, this whole concept of edible landscapes has been really, really. And this is just one example of the kind of things you can do with communities and for communities. Through the Healthy Newtown program, we can just give little gems of wisdom, little bits of impetus to help people help themselves. Just go to the next slide, please. So in the Putting Health into Place document, you can find some case studies from Ebbsfleet and from other places, or feel free to come and look at our website. Again, we have a Healthy Newtown section on there. With Ebbsfleet are now taking forward the ideas that we developed with NHS England and our partners to embed this into the delivery of Ebbsfleet Garden City as a whole. We have some key lessons that we've learned. We've got some fantastic partnerships, and we're really using this first 3 years of the Ebbsfleet program through Healthy Newtowns to set our whole placemaking agenda. Because really, a healthy Newtown is just a great place to live and work for the people of this local area, for the new and existing communities. So I'll be happy to take some questions from people as we progress. Thank you for now.
Fantastic. Thanks, Kevin. It's great to hear about everything that's going on in Ebbsfleet. It's really inspiring. So I know we had a few slight audio dropouts there. So just to let people know, you are able to download the slides from today's webinar, but also, as Kevin said, have a look at Putting Health into Place. There's some really great, more detailed examples from Ebbsfleet, but also from across the 10 demonstrator sites. So please do take a look at that. So just before we move on to our final speaker, Kate, just again, reminder, if you have any questions or thoughts that have been prompted by any of the 3 speakers that we've had so far, don't be shy. Please do fill in the Ask a Question box or email us at hello@kaleidoscopehealth.org.uk. So now, finally, but by no means least, moving on to Kate to talk to your slides.
Hi, thank you. Can you move on to my first slide, which is the one with the map on it? Yeah. Okay, so Whitehill and Bordon is a former garrison town in East Hampshire. It's surrounded about 20 miles to 30 miles away around a radius of Chichester, Portsmouth, Guildford, Winchester and Basingstoke, but no big towns very close to it. There are significant health inequalities, particularly in relation to the rural hinterland, which is affluent home counties. The Army left Whitehill and Bordon in 2015, freeing up land for 3,350 new homes, of which about 450 have now been built. There were also land for 5,500 new jobs, a new town centre, a secondary school which opened a couple of weeks ago, health and wellbeing hub, and a leisure centre which should open in 2020. The town was physically divided by the A325, which is the pink line down the middle of the map, with the old town on the east and the army base on the west side. We've now built a relief road around the outside of the town, and we've got funding to put in crossings across the old A325 to reduce severance and make it easier to walk around the town. There is lots of green space in and around the town, and the town is surrounded by stunning protected lowland heath, which meant that we had to provide a lot of suitable alternative natural green space. And our Hogmill enclosure sang, which I will come on to talk about in a bit, is the second largest sang in the country. There were over 30 partners involved in the Healthy New Town programme, but the key partners are the local CCG, us, the District Council, Hampshire County Council, local GPs, Radian, which is the social housing, and we're also a developer, and the main developer, Whitehill and Bordon Regeneration Company. Can I have the next slide, please? So today I'm going to talk about a couple of projects which demonstrate principles 2, 5 and 8 of the Putting Health into Place document. One of the first things we did was look at the Joint Strategic Needs Assessment for the existing population of the town. This showed us that there were significantly higher than national average levels of children entering and leaving primary school with excess weight, and significantly lower levels of preschool readiness. We decided we needed to dive deeper into this and commissioned insight work into activity levels in families to understand how we could combat excess weight in children. This insight work told us that people felt that they had to travel out of Whitehill and Bordon to be active, and this combined with a large amount of single-car families meant that carers felt unable to be active during the day while their partner was using the car to go to work. We took this very much to heart and worked with developers to deliver a two-pronged approach to support families to be more active actually in Whitehill and Bordon. First, we would deliver amazing open spaces early in the programme that would encourage people to stay in Whitehill and Bordon to be active. And then we would deliver behaviour change initiatives to get families out and about in Whitehill and Bordon. Can I have the next slide, please? Our wayfinding project arose from our ambition to make it easier to walk or cycle around town than travel by car. We focused on an east-west route across the town from the existing town to the new town, which takes in 4 schools and the old secondary school and the new secondary school all along one road. We held workshops with over 200 people, including school groups, community groups and the Disability Action Group, to discover opportunities for improvement along the route. Each person filled out a workbook as they walked the route, and we recorded the results onto a large map. Our consultants reviewed the mapping exercise, and the biggest complaint was that there were lots of grass verges along the side of the road and on the court junctions to other roads, but these had been churned up by vans parking on them. So the verges were basically being used as car parks rather than as places where people could sit or anything. The consultants decided to design a pop-up community garden on one of the verges to reclaim it for the people so they could walk safely along there. School children from 4 local schools designed healthy lifestyle messages on hexagons, which were turned into a patchwork pavement, and they also helped to plant up raised beds with fruits and vegetables. Could I have the next slide, please? The garden was launched at the start of the summer holidays last year, which was that very big heat wave that we had. And we were warned about vandalism and littering by locals, but actually the local residents really took ownership of it. They watered it through the heat wave, and there was no vandalism or littering, and we had overwhelmingly positive comments, and it's still there now looking beautiful and has been replanted as seasons go by. We're working with the Town Council and Housing Association to secure the long-term future of the garden and have developed a legacy strategy to deliver more around town. So we have a pocket park community orchard that we're actually planting today in a nearby plot of empty space. Can I have the next slide, please? So alongside making key routes more attractive, we worked with schools to support families to walk and cycle to school. We provided balanceability training kits to the infant schools and preschools so that under 5s can graduate to pedal bikes. And we launched an adult scooter try before you buy scheme in all primary schools in the town so that parents can scoot to school with their children. And we trained PE teachers to deliver scooter safety training and PE lessons. Next slide, please. So for Principle 8, Enabling Healthy Play and Leisure, I'm going to talk about Hough Enclosure because it really shows what can be done when developers, in this case Whitehill and Bordon Regeneration Company, work well with local partners. Hough Enclosure was the first large piece of infrastructure that the developers had to deliver, and they were determined that it would be worthy of a healthy new town. We held workshops with a number of different stakeholders to ensure that it would be inclusive and accessible to all. And from these workshops, 2 initiatives were born. A natural play area was designed to encourage imaginary sensory play. And the other initiative was dementia-friendly Hough Enclosure, which has been designed with refuges, shortcuts, escape routes, interactive puzzles, and water for people to relax by. Can I have the next slide, please? Hough Enclosure has become an amazing asset for the town, encouraging people to take part in active leisure locally. The park run started 2 years ago and has 170 runners every week, most of whom are local, and many of them graduated from a Couch to 5K course, which we have also set up in the town, which runs on an ongoing basis. And the junior park run started this year at our Spring into Health Festival and now gets around 90 runners aged 14 and under each week. And again, those are local children, so that will be helping to accommodate, to mitigate against the excess weights among primary school children. Can I have the next slide, please? As well as Hough Enclosure, the developers delivered the skate park way earlier than they needed to. So it was a Section 106 requirement that they replaced the existing one. But they went above and beyond and produced a skate park to a very high standard and very early in the build and the development phasing. And it's a really fantastic safe place for teenagers to hang out. We've since given Whitehill Town Council Section 106 funding to install drinking fountains and bins. This was definitely a lesson learned to discourage kids from buying energy drinks while they're there and just dropping them on the floor. So when building new infrastructure for teenagers, make sure you've got the drinking fountains and bins in place. And I just want to talk a little bit about Cafe 1759, which I think is the next slide, unless I didn't say next slide for skate park. But if we go on to the slide about Cafe 1759, so Radian developed the first site, which was the 100 Homes Quebec barracks site. And between 2 old barracks buildings, they built this stunning glass atrium to house Cafe 1759. Radian wanted this to be something really special for the whole community, and they got a public health nutritionist from county to advise them on the menu and how to merchandise the food so that people were encouraged to make healthy choices. We funded a food academy, which is helping to combat holiday hunger and teach families how to cook simple, healthy meals on a budget. We have also launched a preschool readiness programme here with a farm to fork course for carers and children who've been identified by health visitors to learn about where food comes from and how to make healthy snacks and meals. The latest addition to Cafe 1759 is a table tennis table, which was funded through Section 106 money. And then Bordon Enclosure is adjacent to Cafe 1759, so many of the food initiatives will include an activity such as a buggy walk or foraging for blackberries and wild garlic. So my key learning from these projects has been: 1, do the research first. Find out what the barriers to the activity are in your community. Don't rely on anecdotal evidence from councillors and community officers. Then 2 is provide great physical infrastructure that makes it really exciting for people to get outdoors in their local area. And then 3, provide support initiatives to encourage families to get out of their cars and outdoors. And back this up with great social media and local campaigns to create a buzz around the local parks and open spaces. Thank you. I think I might have to be a few slides short.
No, that's fantastic, Kate. And there's just a last slide up there, which is about how to get in touch with you. As I said, people can download these slides as well. Thank you so much to all our speakers. I think that's been a really great overview of the kind of introduction and putting health into place, and then some really great examples of what's being done locally in terms of developing healthy new places. So we're now going to have a chance to come to some of the questions that you've asked. So it's not too late. If you want to submit a question, please do so by using the Ask Question box on the screen in front of you, or email us at hello@kscopehealth.org.uk. But we're just going to kick off with some of the great questions that we have already. So I'll come to partners to respond. One of the first questions, which we've had a few questions in this kind of space, is how we can encourage individuals to be more proactive about their health and well-being. And I know Kevin and Kate, you've given some really good examples there, but is there any kind of general advice? Kevin, I'll come to you first, and then to Kate for reflections on how we can encourage individuals to be more proactive about their health and well-being.
Okay. Yeah, I think from my perspective, the main thing that we've done through the Healthy New Town programme was to understand what local people were really interested in. We've got some back. Oh,
there's a challenge with audio, I think, Kevin. Do you want to? Sorry, try again.
Yeah. So what I said is the main thing for us was to understand what local people were interested in and what kind of things they wanted to get involved in. And I think once you understood the kind of activities that people were involved in, it was then almost trying to find tools that helped them get involved and help them actually take control of their own health. And the two examples I used today were the Better Points application, which was again just giving people information about how active they were, and also through the Edible Ebbsfleet one, where we're actually saying local people told us they wanted to grow, they wanted to get healthier, they wanted to understand about food, and then responding to that. So it is very much starting with the people you've got. And one of the challenges in Healthy New Towns were that some sites didn't have any existing people. In our instance, because we had existing communities and arriving communities, it's very much listening to both and trying to find some tools particularly that worked for both new and existing communities that broke down some of those issues. And I think once you actually give people the information, they're really, really keen and interested in taking control of their own health.
Fantastic. And Kate, any further thoughts on encouraging people to be more proactive about their health and well-being?
Yes, it's really about using your local knowledge to know where to go to sort of infiltrate into the local, well, not infiltrate, but to get into the local groups. So we really targeted the schools and the parents of the children at the schools. So I mean, they were a bit of a captive audience. We invested a lot of money in working with local schools around things like the peddling to school Golden Mile things, and then introducing programs that were also really easy for people to do, you know, it was as easy to do as not to do, and also things that were free like the park run and subsidising things like the Couch to 5K, going into doctors' surgeries, mother and toddler groups, just really knowing the local community and being able to take your messages there, working with other organisations such as the Community Trust and the social housing to use their connections to get down to the people who needed to hear the messages, and then making it easy for them to do them. And then in some cases actually with through the social prescribing, actually hand-holding people, sort of taking people along to groups.
Fantastic. Thank you so much. That's really great to hear. We've had a question which I might come to Julia and then to others if they want to chip in around how planners can best address health inequalities when planning for green infrastructure.
Yes. One of the things that is really important to do, as Kate mentioned, is to really understand the health needs of the local community, which are set out in the Joint Strategic Needs Assessment. And from that, you can then think about how the new development, and particularly green infrastructure, might help address those needs. So if there's a real problem with young children or children of any age not getting active enough, then as they did in Whitehill and Bordon, perhaps one of the things to do is to think about how you can create some green infrastructure that will really encourage kids to get out and about and be active. And I think the Whitehill and Bordon example is fantastic because the Hogmore enclosure is a really wonderful place. You would absolutely want to go there. You wouldn't have to be told to go there or told it was healthy. You'd want to go there because it's fun and exciting, and it's free, and it's on the doorstep. So it's really understanding the health needs of the local community and then seeing how you can address them through the design and management of your green infrastructure or other community facilities as well.
Fantastic, thank you. Thanks very much, Julia. That's great to hear. One of the questions, well, actually, we've had a few questions in this space about, and I'll come to Kate first, and then Emily, I think, from a kind of national perspective, is what were some of the biggest challenges you faced, or still face, recognising that this work is still underway and is by no means finished. So, what were some of the biggest challenges you faced, and how have you attempted to overcome them? So, if I could ask Kate to provide some reflections there first, and then Emily from a kind of national perspective, if that's okay. Kate.
Right. So one of the first ones was the biggest one was the partnership working, I guess, and the number of different partners that we had to work with, and understanding their drivers. And it's not new to say that to the outsider, the NHS is quite an opaque and confusing organisation. So just understanding which part of the NHS we should be engaging with. I mean, we were quite lucky, actually, our local CCG was amazing, but there were other organisations that we didn't know whether we should be engaging with or not. And then just every single partner has very slightly different drivers, so trying to align those has been tricky. But we were quite lucky in that we had a good governance structure already. And so we were able to fit the programme within that and just invite some more partners to the table, so to speak. And that has worked really well. And we've always been, because we've had good governance in place, it's meant when there have been sticky issues, we've been able to move them up the governance chain and sort them out. And then the other issue has been, which is the trickiest one, and it's still ongoing, is delivery as a health hub, because it wasn't on NHS. The new health hub is not on NHS-owned land. It's on MOD-owned land, and it's a different relationship. The NHS knows how to build doctor surgeries on their own land, and it's not owned by the GPs. So there's multiple stakeholders involved in that, and trying to get the right operational model for that has been tricky, but we are getting there. And it will be a great it will be a great case study when it is finally all up and running.
Fantastic, thanks. That's certainly both of those things are things that I think have been raised across a number of sites. So that's helpful. Emily.
Yeah, so I think I would reiterate some of what Kate said around the partnership working. So when we started the programme, I guess there were questions around why are NHS England even getting involved in housing development, and one of the things that we have found is the challenge and then the opportunity of overcoming the differences in languages that partners in this space use, often to talk about the same things. We're all trying to achieve a better outcome for our local population, but how we tackle that can be quite different, and the language that we use in doing that is often quite different. So I think one of the greatest things that we've had to overcome is bringing those partners together and helping create a shared language. And that's been done really successfully locally in the sites, and nationally we've been strengthening cross-government working as well, and thinking about how we partner with the Department for Health and Social Care, but also with the Ministry for Housing, Communities and Local Government, to think about how we can build some of the principles of putting health into place into future housing infrastructures, and levers, incentives and requirements, possibly even regulation at a national level. And it's been as much of us building that partnership nationally as it has locally. And I think actually public health has been a real link for us, so that locally you've got public health in the local government, and regionally now in the NHS we've got public health sitting within our regions as part of the core team. And as has been referenced by Julia and Kate, the joint strategic needs assessment has been a real mechanism to bring people together and create that shared language, and I think that's been one of sometimes the most challenging thing, but actually the thing that will hopefully really stick.
Yeah, and I'd just as a plug for our further webinar next week, which is about actually how do local planning and health bodies work together to deliver healthy new places. And we're going to have Julia also speaking, but also Natasha from NHS England, who's got a specific estates role, who will have lots of helpful advice about key people to engage from the NHS side. We're also going to Northstowe joining us, actually somebody from public health, as that kind of bridge, as Emily said, between health and planning. So do tune into that same time next week, 4th of December. So just moving on from plugging other webinars, just in terms of other questions. So on the flip side, we've had a lot of questions about what people's biggest challenges are and how they've overcome them, but also we've had quite a few people asking, what would you say has been your biggest achievement? So I don't know if I can come to Kevin first, and then to Kate from a sort of local perspective to say what you think your biggest achievement has been. Kevin?
Yeah, I guess the biggest achievement for us, I think, is twofold really. The impact that we've had with local people and on the development that we're delivering, and also on the long-term legacy of that. So just thinking about in terms of impact, I think both the new community moving into Ebbsfleet and the existing communities that surround us are very much aware of the Healthy New Town programme. They very much embrace the different activities that we've been promoting. They would be, real advocates and ambassadors for the programme, which I think is great. And I think that's why I think my greatest achievement, or our greatest achievement, is the legacy. So some people think that the Healthy New Town programme was a 2-3 year programme and then that's it. Well, really, I think NHS England have done a fantastic job of giving us the impetus and setting the scene, really, for us to deliver these places over the next 10 or 20 years. So in our case, I think the impact on our legacy has been fantastic in terms of Ebbsfleet. In terms of our built environment, we are actively now trying to deliver the parks that were inspired through the Healthy New Town programme, the Landscape Design Challenge. Just in the last month, we've actually bought the central area of Ebbsfleet, 125 hectare site, which includes Blue Lake, where we're going to put the winning scheme. And within that central area, we're also now actively trying to deliver the health and wellbeing hub that was delivered through the collaborative design process that I talked about earlier. And also as a development corporation, instead of closing down some of the activities we do through Healthy New Town, we're actually stepping them up. So in terms of community building, we're spending twice as much on community building this year as we did through the Healthy New Town programme. And we're now trying to develop a new model for long-term stewardship to the place, which we hope will be also a good lesson and a model for other healthy new towns or other healthy communities or garden communities coming forward. So I think the fact that we started off with some ideas and tested some new thinking in Ebbsfleet through the Healthy New Town programme, that's now become good established placemaking. I think it helped us really understand what placemaking is about. It helped us understand what our communities wanted, and I think it's really set the scene for how we move forward. So the achievement to me really is embedding good placemaking, which I don't think necessarily would have happened had we not been a Healthy New Town programme.
Fantastic, thanks Kevin. Kate, what would you say your biggest achievement has been?
Oh, there are so many. It would be really difficult to isolate one thing. I think all the stuff that we've done around the healthy and active lifestyle strand, like the park run, the junior park run, the preschool readiness and food academy has been brilliant. We did a really important piece of work on social inclusion that was a really good insight work that has led to a lot of projects that are just getting off the ground now. Normally after the programme has ended, but they're just being sort of going through their inception now around sort of like tackling social isolation. There's bits of infrastructure that have been produced. The Hogmer enclosure is fantastic and it's quite iconic. It's that sort of like that visual picture of the two towers with the network ramp going between it that's just amazing. Then things that don't look so great, the fact that we've got four changing places, toilets in the new town centre, one of them on Hogmoor, one of them in the leisure centre and two of them in the town centre. That's incredible. That's I think there's only one in another town in East Hampshire, so that makes a really real difference to people who need accessible toilets. Sounds like a little thing that's really important. And then personally and professionally for me, I've gained an awful lot from the programme as well. I've done lots of speaking and stuff which I wouldn't have done before, and East Hampshire District Council and our partnership got a planning award for partnership working, which I'm so proud of the whole team for, because partnership working was something that we had to work really hard on.
Fantastic, thanks. And I'll just come to Emily to also, from a national perspective, what would you say in terms of achievement?
I mean, the local impact across the 10 sites is obviously a huge thing to be proud of, as is putting health into place. Julia, the team, all the partners have put a phenomenal amount of effort into that, and we're really grateful to see such a high quality product available. But I think one of the things that I think has been a real success is when we reached out to the system and regions and local areas and said who would like to work with us on learning and implementation, the response was really encouraging. And to build on that, having seen some of the draft long-term plans that have come in from local systems, many of them are starting to talk more about how health should engage in the development of its local community and new housing developments. And that shift to a focus on place and thinking about how we can support that collectively, health in partnership with others, I think is a real achievement. And having these principles available now as people recognise the importance of that focus on place is fantastic. So we're giving people something to use as they make that shift and increase that focus on creating healthier local environments for our population.
Fantastic, thank you. And I think I'd probably speak for Julia as well. We've been out delivering learning and implementation events around these 6 sites, and actually the level of enthusiasm and engagement, and actually the value you can see from all the learning that's been collected into putting health into place has been really encouraging. So I would definitely echo that. So I'm just going to move on to possibly 1 or 2 more questions, but I just wanted to give a heads up to our panelists. In about 5 minutes time, or 6 maybe, I'm going to come to you for a closing reflection just as we finish off. So we'll do it in the order that we spoke. So I'm going to come to Emily first, then Julia, then Kevin, and then Kate. So just giving you time to have a think about that. But just moving on to a couple more questions, if we can fit them in. One of the questions that's come up in a few different guises is there's, obviously hearing from the programme, there's been lots of community development activity for new communities, and also learning points where new developments have developer requirements, or there's still money being used in existing communities. I guess the challenge is where there isn't necessarily that money, what could you do to help communities become healthier without necessarily having to invest large amounts of money? I mean, it seems to me that lots of things have happened without huge sort of investment, but it would be great to just get some reflections from Kevin and Kate, and then either of our panelists in the studio about what can be done where finances can be challenging. Kevin, have you got any reflections on that point?
I think the key we're trying to do through all of the Healthy New Time programme is to shape people's behaviours and get them to kind of live healthier lifestyles. So it doesn't actually cost money to have a healthier lifestyle or to get involved in the community. And I think what we found is the most continued successful element is about the partnerships that have been formed, about the friendships that have been formed, about the new initiatives and new ideas that have been stimulated through the Healthy New Time programme, but will be sustained beyond the programme. So it doesn't really take a huge amount of money for people to come together with ideas, with initiatives, to take their own initiative, and whether it's a park run that Kate mentioned or other things, it doesn't necessarily take money to do that. It doesn't take money to take control of your own health and your own well-being and to get involved yourself. Sometimes it's just that little impetus to get involved and actually knowing what's around and how to get involved. So I think for existing places or for existing communities, it's really about having that ambition, having a plan, coming together and actually trying to do something significant from small issues, from small points, small interventions from individuals can make a big impact overall.
Fantastic, thanks. And Kate, any thoughts on that point?
Yeah, I would agree with Kevin that it's really about getting your community champions going, and for the larger stakeholders who are a bit further removed from maybe the local community to know who the key people are in the community, and also the key organisations on the ground who are out there delivering things already and helping and just making that tweak to bring health into it. So for us, working with Radiant Housing was really, really key in opening up the door to really working with a lot of people locally in the community and sort of just tweaking their messages and tweaking what they were doing to put a real health focus on it. So that was really important. And then another initiative which we are sort of about helping with at the moment is Time Bank, which is where people volunteer their time to help other people, and particularly around social isolation. And in the run up to Christmas, we're doing a lot around knowing your neighbours, Christmas card, working with schools to do just like Christmas card projects, so where they're giving Christmas cards to the elderly people in their streets, and like little things like that. So for like the elderly people, just making sure that they have contact, and Christmas lunches and things like that. At this time of year, it's really good. So taking that opportunity to have of Christmas to help make those connections locally and help people do more. I think connection is really important in terms of being healthy and active within your community. And if you are connected, you're more likely to go with a friend to a Zumba class or something like that, or to a gentle chair exercises class. So it's really knowing your community well.
Fantastic, thanks. That's great. Anything to add to that?
I think one of the stakeholder groups that we haven't talked a lot about that I think have been quite active in all of our 10 development sites is the voluntary and community sector themselves. Mm-hmm. So there are many different national and often locally based charitable organisations or community-based organisations which have added real value to each of the demonstrator sites and often bring those kind of innovative community development activities and ideas. And I think it's really important that they're recognised and utilised through any kind of new development. And I think the other thing that we really need to challenge ourselves on is how we can use the existing investment and the existing money in the system to best support the putting health into place principles and think about embedding health and well-being into how money is currently being spent. And there are examples of things like social prescribing that Julia mentioned earlier, which have got some investment that can be used and targeted to support some of these kinds of initiatives. So I think it is challenging. We are constantly working in a challenged financial environment, and we need to reflect on that. But actually, we can be creative, I think, sometimes in how we're using some of our current investment, and just making small adjustments can really enable some of the activities that we've heard Kevin and Kate talk about.
Mm. Fantastic, thank you very much. I think we're just going to squeeze one final question in. I'm just going to ask Julia to reflect, and then I'll come for final reflections. Julia, one of the questions which I thought you might have a view on was whether you've got any experience of how people have influenced the design and quality of housing vision in terms of what the demonstrator sites have done, or just in from your perspective from the Town and Country Planning Association.
Yes, I think that this can be done at all sorts of different levels. It's fantastic if you have political leadership, local leaders who say the quality of what we're going to build is absolutely vital and are prepared to stick to that. There are other ways forward, such as setting up design review panels where design proposals are looked at by a panel of people who can comment on how they could be improved a bit and to focus on health through that process. And also, if you look in putting health into place, Darlington set out some principles which were about achieving high quality designs, and they then put that into their local plan to make sure that any development that comes forward in Darlington will have to meet those standards.
Fantastic, thank you so much. So I just want to say thank you to all our speakers. I'm just going to come to you now for a final reflection, and also thank you to you for tuning in today. So Emily, final reflections following the discussion.
I would encourage you to take a look at the putting health into place principles, use them. One of the most critical things is develop that shared vision, create that shared language, and be enthusiastic about working in partnership together for the benefit of your local community.
Thank you. Julia?
One of the things that came through very strongly from the Healthy New Towns was that the new developments were designed in a way that would really help the existing local communities. And I think often that doesn't happen. The existing community has to put up with all the disruption of a new place being built, and they don't really get much from it. Or if they do, it's years down the line. So thinking about how the new development can, right from the beginning, help the existing community can be really positive.
Fantastic, thank you. Kevin, final reflection from you.
I mean, picking up on Emily's point, I think what we find is that there's a lot of spending in a new place, whether it's through new models of care or through built environment or other things. By joining up that spending, by joining up our thinking, we can actually do a lot better with that investment. Some of our partners, like Adult Social Care or the local CCG, they have to deliver new models of care. They have to deliver a solution for adult social care. So actually doing it through this programme, working together to think that through, is a way of actually making more than we're all going to do ourselves. So that collaboration, I think, is something we'll continue in Ebbsfleet, and those partnerships will continue.
Brilliant. And then Kate, finally, final reflection from you.
Yeah, well, one of the key things that I bang on about with my councillors from time to time is that the healthy new town is not just about health facilities. If you're designing a healthy new town well, the health facilities should only be needed at end of life. It's about making the population healthy so that you're preventing that need of having to put in a lot of health facilities. And then also working with partners and building in sustainability and the long-term legacy of it, so that it becomes a mainstream thing to think about health across the organisation, all the organisations, when you're delivering a new town.
Thank you. Well, that's 2 o'clock. Thank you so much for joining today. Do please join next week's webinar on how to integrate health and planning at a local level. Hope to see you then. Thank you. Bye-bye.